Dr. Hyman, what's your thoughts on that with the idea we're spending over $1 trillion, we're spending more money than we've ever spent, but we're going in the wrong direction in terms of health care. When you look at 42%, pick a number, obesity of adults, 20% with children, that's wrong. That's sad. We could do a lot better. What's your thoughts on it?
Thank you, Chairman. I think that...
Can you put the speaker?
Thank you, Mr. Chairman. I think this is a very important issue because, as Senator Frist said, we now have the science, and the science and the data are clear that we can solve this chronic disease epidemic by focusing on its root causes. I practice root cause medicine. Some people call it functional medicine, systems medicine, network medicine. It doesn't matter. The key is, what is the root cause? In America, we mop up the floor while the sink overflows. How do we turn off the faucet so we deal with the root cause of the problem, which is the food that's driving the chronic disease epidemic? And I think there's a lot of levers that government can pull. Many of them were mentioned here by the panel. I think a deep understanding of food as medicine is very important. I think most people still don't comprehend that food is not only something that can be used for prevention of disease, but for the treatment of disease, and that it often is a better treatment than medication. Medication has a role. It's important. It's not that we want to get rid of it, but we have to understand what is the actual right treatment for a patient. Just like this patient, Janet from Ohio, she lost 116 pounds and reversed all her diseases. This is not something that you could do with medication. She was already getting the best medication from the best healthcare system in the world, and yet she wasn't getting better. And I've seen this over and over in clinical practice. We've demonstrated this in our research at Cleveland Clinic. There's many data points that we have in the scientific literature that by applying the science of food as medicine, that we can transform biology. And for those of you trying to understand what does that mean, what does food as medicine mean, it's not just a metaphor. Food is literally a code that you're eating. Every molecule in the food you're eating translates into changes in your biology, in your gene expression, your immune system, your brain chemistry, your microbiome, your hormones. They're all regulated by the molecules you eat. And if they're molecules that produce health, it creates health. If they're molecules that produce disease, you get sick. And primarily the molecules that we're eating in America are not actually food. Food, by the definition in the Webster's Dictionary, is something that promotes the growth and health of an organism. By definition, most of what America's eating, ultra-processed food, is not food. It actually does the opposite. It promotes disease. So I think understanding how do we make nutrition central to healthcare? How do we reimburse for it? And I say in my written testimony that we don't have evidence-based medicine, we have reimbursement-based medicine. How do we move to more evidence-based treatments? In fact, every professional association, American Heart Association, National Heart, Lung, and Blood Association, from the NIH, the American Diabetes Association, all recommend lifestyle therapy as the first-line therapy for treating high blood pressure, for diabetes, for heart disease, and yet it's not done in healthcare because it's not reimbursed. If tomorrow doctors were paid to do the right thing, not the thing which they get paid to do, this would change very quickly. So I think the medically tailored meals program, produce prescriptions, incentivizing nutrition services and payment services for physicians in healthcare is critical. I think reforming our medical education system. I think the federal government spends $17 billion for graduate medical education. None of it comes with any ties or recommendations for including nutrition services. I think some of the work we've done and you've done, Mr. Chairman, has helped change that, and the ACGME, the American College of Graduate Medical Education, is now going to provide nutrition competencies as part of their training. And I think that we have an opportunity to do some really bold things through CMMI and Medicare demonstration programs like a diabetes like a diabetes reversal program, which has never been done before.
Doc, let me ask you,